Hello, I'm Dr. Carla Colella, physical therapist, owner of O'Connor Walk Physical Therapy, and I'm going to do a little tutorial of basic foot taping. You think about it as sprained ankle. There might be a time in the healing process where you feel comfortable walking around if you have an ankle brace on, but you don't always need the ankle brace. So think plantar fasciitis, or as it's come to know now, plantar fasciopathy, posterior tibialis tendinitis, tendinopathies. There are some other conditions that mimic those two, and so if this doesn't affect it at all, you may have one of those, and you should definitely get assessed by a healthcare provider, such as a physical therapist. So if you think back to that, rethink to the analogy of spraining your ankle and wanting an ankle brace for a little bit, think about it like that. So before you get, custom orthotics, just something to try in the acute phase. The tape I generally use for this in the clinic is called Leukotape, and it's a little brown. You can see I kind of cut it in half so it's just skinnier. The difference is that this tape is very rigid. It's really not going to allow the foot to move at all. For viewing purposes, I'm going to use Kinesiotape. It just shows up better against my skin color. And the big pros and cons of this is just it's going to be a little bit more flexible, so it's going to let your foot move, but it'll still be a little bit supportive. So I do first is take my standard Kinesiotape and cut it right down the middle. You want to make sure that the foot is at a relative right angle, so not too much down like this or up. Also not like twisted in or twisted out, so just try to keep it in a nice and neutral. Little checkpoint here. If you pull up your big toe and you can feel this tendinous tissue kind of pop out, that's a good thing. So I'm just going to get a general sense of how long I want this to go. It's going to go from right in between the first and second toe, and around the heel, and back up into this little teardrop shape. Kinesiotape stretches a little bit, so if you cut the ends, there we go, it'll rub off. If you cut the ends, it'll be less likely to rub off. And then also if you just get a little bit going, then you don't have this big sticky mess that's going to get tangled up on itself, and you can peel as you go. So because it's kind of stretchy, if you stretch it out all the way and put it on, as soon as you begin to walk, it's going to peel off. So don't use the stretchiness of it that much. So again, we're going to go in between first and second toe, foot at a right angle. Kind of go around the foot. And we're going to need about that much. Go. And I'm going to do the exact same thing, slightly shifted. Right angle in the foot again. For the next step, we're going to make some horizontal stripes. So you want it to go from just the side right along the edge of the ray of the bone, and on either side. And it'll probably take about 3 to 5 strips going down the middle of the arch of the foot. I'm going to start on the outside, right angle in the foot, across. Starting at the bottom. And I could put this third one here, but I'm just going to show you, I usually have that last one be a little kind of closer to the heel, so there's just kind of that empty heel basket. And then the last one just anchors those side straps in place. Just going to put it around the side of the foot. There we go. So if you've done it right, you should feel that when you stand on it, you can go through that whole gait cycle and it doesn't peel off your foot. All right? You should feel that when you just stand all your weight on one foot, that arch doesn't drop as much as it maybe did, and that you can keep the weight more centered in your foot. Other than that, I feel like having the tape on your foot for the first time feels like probably what a dog feels like if you put socks on it. It's just feels like you're wearing a sock when maybe you're not. The tape should stay on for a shower, even if you do a lot of things sweaty in your foot, it should stay on. The more you move, the more it gets flexible, the more it's not doing its job. So something you can redo every day as long as there's no skin sensitivity. If there is skin sensitivity, of course, take it off. Don't do this method. And like I said, this is a short-term use. If this is beneficial, you may have a condition such as plantar fasciitis, posterior tibialis tendinitis. If it is not, it may be from some other cause. All conditions worth getting looked at by a physical therapist, but sometimes it might take a while to get into one. And again, just a quick something you can try in the meantime while you're home. If you found this useful, I'd love to know in the comments below. Thank you.